Well, hello, I'm Charlie Hull with the Blessing Health System marketing team, and we're glad to be joined today by Caitlin Holland, pharmacist at Illini Community Hospital, to tell us a little bit about some of the outpatient options for folks with COVID-19 when it comes to treatment options. And Caitlin, thanks for joining us today.
Thanks, Charlie, for having me. I really appreciate it.
Let's give you an opportunity to tell people a little bit about yourself and what it is that you do at Illini.
Sure. Well, my name is Caitlin Holland, and I'm a pharmacist here at Illini Community Hospital. I usually work in the inpatient pharmacy, but we also cover outpatient departments within the hospital. I've been here at Illini for about 6.5 years now. I'm originally from outside the St. Louis area, and I've actually lived in the region now for 6.5 years.
There's some exciting newer treatments when it comes to the treatment of COVID-19. And I think when, we're almost a year into this pandemic, I think when this first started, that was one of the big fears for people. We just didn't know very much about how to treat the virus. And we're learning more about that each and every day. But a couple of treatment options are now available at Illini Community Hospital on an outpatient basis. And let's first talk about what that means for folks.
Sure. So these are treatments that are only being used for patients that are not in the hospital. So it's only going to be for patients who do not require hospitalization and who have mild to moderate symptoms.
And there are a couple of different drugs that are being used for this treatment type. And let's give people a little bit of information on those and reassure them this isn't something that's brand new. These are drugs that were already in the market.
Yeah, sure. So both of these medications are a part of a class called monoclonal antibodies. They're a little hard to say, but one is called bamlanivimab, and we call it BAM for short because it's much easier to pronounce. And then the other one is the Regeneron cocktail. So it's a combination of two medications in one, and those are both to be given for the same indication, treatment of COVID-19.
So we're going to talk in just a little while about really how the drug actually works and what it's going to be doing. But let's first talk about who is a good candidate for this type of treatment.
Sure. So the first qualification is that you have to have a COVID-19 diagnosis, preferably within 7 days. I do believe that they would make an exception within 10 days. But what's really good about these treatments is if you give them within a short time period of initially being diagnosed with COVID-19. So that's the broad spectrum of what you need to have is a actual diagnostic test within 7 days. Some other characteristics are you want to make sure that you have mild to moderate disease. What that means is you're not requiring any supplemental oxygen. You don't need to be hospitalized. You are stable condition in regards to your symptoms. And you also have to qualify as a high risk patient. And now what parameters there are for high risk is a BMI of greater than or equal to 35, which would classify you as obese, a chronic kidney disease diagnosis, greater than or equal to 65 years of age. So their geriatric population is definitely qualifying for this. A history of diabetes, or a history of an immunosuppressive disorder or on immunosuppressive therapy. Another category you could qualify for is greater than or equal to 55 years old, but you also have to have high blood pressure, heart disease, or history of severe lung disease. And then your last category of patient that would qualify for this is patients aged 12 to 17 years old, so the younger population, but you also have to have significantly overweight, or you have to have certain chronic illnesses such as sickle cell disease or asthma.
For the folks in that age category of 65 and older, which has really been the area that has been affected the most with the COVID-19 virus that we've seen folks really have a struggle with, you talked about several of those comorbidities, and somebody doesn't have to have all of those issues, but they just have to have at least one or more of those issues.
Yes, so you have to have any of those high risk categories. If you're greater than 65 years old, then you're automatically able to get that. But yeah, our population we're trying to focus on here is those individuals that get COVID-19 and they're at risk for being hospitalized. So the things that I went over just a couple minutes ago are definitely going to put you in the qualifying category. And if you have questions about whether you qualify, because it is a lot of information to check box through to make sure you qualify, you can contact us and we can go through your case with you and set up a screening for you.
And we will tell people this number again at the end of the interview, but the number to call at Illini to see if you are eligible for the outpatient infusions is 217-285-2113, extension 3950. And there'll be some screening questions that they ask you, a lot of the same information that Caitlin just talked about, to make sure that you are eligible. And I think something you said at the outset is very, very key, and we really want to encourage people, is that time is of the essence when it comes to this type of treatment. So the closer to that original diagnosis that you could get this treatment, I think you're seeing a lot better results.
Yeah, definitely. I agree. And something that I want to circle back on too is that these medications were under the emergency use authorization by the FDA, and they actually have been in use under that, it's called an EUA, since November. I know that Blessing Hospital in Quincy has used them quite frequently since November, since they received them. So this has been used and studied for quite a while now in COVID terms. So we want to make sure that people know that it's being used across the country. The state of Illinois has been who has given this medication to us to be able to use in our population and in our community. We want to keep patients out of the hospital. We want to get patients back to their normal, and we want to make sure that people are staying healthy.
So if I am someone who meets the qualifications, I call and I get screened and I set up an appointment, and that's how that's being done still at this point, is that same number that we gave earlier, the 285-2113, extension 3950. What am I going to experience after that? What actually happens on the day that I'm receiving the medication?
Sure. So you'll talk with a screener and you'll get set up for an appointment with a nurse. They will evaluate you and also call in a provider. One of the providers here at Illini will come see you as a patient. You'll get your vitals checked, your history checked, and you're actually going to receive one of these medications if you meet those qualifying parameters we talked about earlier. And once they deem you appropriate to receive that treatment, we will make up this medication. It is an IV bag. So the whole process for receiving it is you're going to receive it over an hour, but in total, you're going to be here at the hospital probably around 3 hours. The first hour is probably going to be made up of you seeing the provider, then checking your vitals. The next is going to be about an hour for the infusion. And then the final hour is going to be just some monitoring afterwards to make sure that you're not having any infusion reactions and make sure you're stable enough to go home.
And what is the infusion itself actually doing? How is it helping to lessen the severity of the disease?
Sure. So both of these medications work similarly. Like I said, they're called monoclonal antibodies. And what they actually do is they neutralize the COVID-19 molecule by attaching to its spike protein. And it basically neutralizes it from being able to access your cells in your body. So hopefully the idea is that you don't progress to a severe disease and you don't end up in the hospital. So that is why they've been using it. And that's why it's under the emergency use authorization with the FDA. So patients should expect to start feeling better in the next couple days after receiving.
And I think, again, we do want to encourage people that, if you get a positive diagnosis, if you wait long enough to where maybe your health has deteriorated to the fact that you feel like you need to maybe be seen in an emergency department type of setting, at that point, you may no longer be a candidate for this type of treatment.
Yes, that is true. If you feel that you are very short of breath and are requiring oxygen supplementation, this medication regimen is not for you. I would recommend you contact your primary care provider, or if you are severe enough, go to the emergency room to be seen.
One of the unique things with this type of treatment as well is the fact that you don't necessarily have to have an order from your primary care provider. This is something that you can self-refer as long as you meet the qualifications.
Yeah, so people have the ability to contact us and set up their own appointment for this. And that's the good thing about this, is that your provider is there for you to contact if you have questions, but you do not need to go to them in order to get set up with us.
So we just wanted to share this information. our hope is kind of like a lot of things that we do, Caitlin. We hope that folks will never have to have this type of treatment, but want to let them know that it is available for them should that need arise and they meet these specific qualifications. We encourage everyone, once again, if you feel like you're someone who may be an eligible candidate for this type of treatment, to call Illini Community Hospital at 217-285-2113, extension 3950. They'll be glad to work with you. If you have just a question about it, if you're not sure, we encourage you to call as well, because again, we want to keep people out of the inpatient hospital setting because those folks sometimes have a harder time recovering from this. This can also very much shorten the length of the disease that the person will be experiencing.
All right. Well, thank you so much.
All right, thanks, Caitlin, for joining us. And again, that number to call, 217-285-2113, extension 3950, and you can learn more at blessinghealth.org.